Quick question before we get started with the show. Do you order lab tests from companies like Dutch, DSL, Genova, or Vibrant America? Hi, I'm Dr. Carrie Jones, Head of Medical Education at Rupa Health, the absolute best place to order, manage, track, and get results from 30-plus lab companies all in one place. Practitioners using Rupa Health are saving well over 15 hours of admin time each week for their lab ordering process. With just a few clicks, you can order from 30-plus lab companies, that's over 3,000 tests, for free in one single portal. That means one invoice for all labs, paid online upfront. Plus, patients get practitioner pricing and receive full patient support through easier personalized collection instructions, automated follow-ups, super bills, answers to testing questions, and so much more. Go to rupahealth.com to sign up for your free account today. Now, let's start the show.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, welcome to Redefining Medicine. Today, we're interviewing Dr. Travis Wilkes. Dr. Wilkes is a family practitioner by training. He's in private practice, but he's also an expert in gut health, and he's going to teach us about the tests that he's using to actually help us understand what permeabilities looks like and how to improve gut health. How's that?
Great.
Right? All right. Thank you, Doctor.
Yeah, you're wonderful.
All right. Well, I'm not. So tell me how you got into this. And I think it's interesting because you're talking about a blood test, so it's amazing. So tell us more about it.
Yeah, so I'm a family doctor by background, so I'm sort of a jack of all trades person. I've seen every possible disease state, every age range, everything. And when I think about things with patients, so many things go back to, do they have some degree of chronic smoldering inflammation, and do they have a gut health issue? Because those two things are fundamentally problematic in so many people. And that drives metabolic disease, that drives mental health issues, poor sleep, all these things, they're all at a core inflammatory and gut health issues. And so I'm a medical advisor at Excella. Excella is a blood-based microbiome test. And I found them by way of really searching for what is the best way to look at gut health and really have good markers, it's hard data points that doesn't leave me guessing. So how did you how do you find it? What do you do? What does the test do? Yeah, so the test is it's a pinprick test of the finger. So you use a lancet on the finger, and you use sort of a novel device that's similar to a dried blood spot to collect a little bit of blood. You send it off, and 10 days later you'll have results. When you get the results back, you get 11 different metabolites, and they are focused on the purine pathway and the tryptophan pathway. And then you gain really a very nice functional understanding between how the body and the gut are communicating and really what's happening at the gut that's translating into health in the body.
So what are the tests, that you're doing, and what do you do with the results?
So with the 11 metabolites, I think it's a little bit overwhelming to talk about all 11 metabolites at once. It's very confusing. And so to think about it, I think about two fundamental ones first. And so uric acid and IPA. IPA stands for indole 3 propionic acid, and we call it IPA because it's way easier to say. So just say IPA.
IPA.
So with uric acid, we're more comfortable with, and so that is the end product of the purine pathway. And so purines are taken into food and they're metabolized in the gut, and then they have a role in the bloodstream and ultimately becomes uric acid. Uric acid is strongly implicated in metabolic disease, obesity, hypertension, all these different things. And it can be due to poor diet, it can be due to poor sleep. There's all kinds of contributors that you really have to dissect a history to understand. But if someone has high uric acid level, they're at high risk for multiple different chronic diseases and largely chronic inflammatory diseases. There's a standard reference range that people are comfortable with, but the reference range is very wide. And we really are not thinking about optimal when we think about the reference range. We're thinking about, is it typical? Is it okay? And so I think because there's a lack of flagging on the lab, people say, oh, that's okay. And they don't really dive into it as deep as they should. The Excella lab looks at what is an optimal range. And it tries to encourage people to make changes until they get into that optimal range.
How do they figure out what the optimal range is?
So the optimal range was figured out through research on looking at people based on how they sleep, how their lifestyle is, what did other factors look like. And an optimal range was determined that took those into consideration that typical reference ranges don't. I see people who have high uric acid levels and they say, I don't have a high purine diet. And I say, oh, okay, well, what do you have? And then they have maybe high caffeine in their diet and poor sleep. And one of the 11 metabolites is a byproduct of caffeine that enters the xanthine pathway and ultimately becomes uric acid. And so maybe they're a person who's highly stressed out all the time, and they drink a lot of caffeine and they don't sleep well. And that's driving their uric acid up. And that's the big driver of their metabolic dysfunction. And they didn't realize that because it wasn't brought up.
And the doctors won't realize that.
Exactly.
You know, I actually just thought about a patient in my practice who is a 30-something-year-old guy who's high stress, works nonstop, has high uric acid, has been told he has gout. There's no way he has gout. He has nothing that's gout, and he's on allopurinol all the time. And the problem is, clearly, you just answered what his issue is. And he drinks a lot of caffeine, and his brain doesn't function so well.
So he's the perfect person for this test. If you were to take this test, all of what you just described would be laid out, and it would give you the clinical targets to say, okay, we need to intervene here, we need to intervene here, and then he could make those focal changes, and then 3 months later retest and see the results and say, look, you improved here and here, you didn't improve so much here, this is where we tweak, and then in 6 months you'd have him feeling tremendously better.
Off allopurinol.
Yeah.
Another detail, right. But that's great because that you're opening, it's not just about the gut, now you're opening a completely different picture. You're putting together the whole picture,
and that's
which is really great.
That's how I've always thought as a doctor, as a family doctor, I've never been able to dice the body up. I've never been able to just look at the heart and just look at the lung. Like, to me, it's all one thing.
Right.
And this test really completes that picture for me because the gut is always the missing part. Like, it's always, I can test your potassium, I can test your thyroid, I can test all these different markers. But the gut always, I have to guess, and I have to make assumptions.
And you know what, though? When you test the thyroid, when you test everything else, you're testing these huge ranges anyway. You're not testing optimal ranges. You don't even know what the optimal range is because you're looking at disease, towards disease. And this is not about disease.
Exactly.
So tell us more.
Yeah, so I mean, exactly what you're saying there. I think about it in disease states like non-alcoholic fatty liver disease, which I think we're all focusing much more on now as we're recognizing it as such a big issue. But there's no good test for non-alcoholic fatty liver disease. We look at liver enzymes and we look and say, are they in the normal range? Okay, but we don't look at the changes of them. The normal range, people are at the high end of the normal range. They could have non-alcoholic fatty liver disease and it gets masked. But often those people will have high uric acid. They'll have other gut-related dysfunction because gut issues are very tightly tied to metabolic issues and very tightly tied to non-alcoholic fatty liver disease. And we have to start looking at everything on a continuum and really bring things together and say, okay, let's look at this person as a human, and what are the data points we need to assess them as a human and then make them a healthier human.
Beautiful. So tell me about the IPA.
So IPA is a marker of gut lining permeability, basically. And so if you have an optimal level, which is a higher level of IPA, then you have a very nice gut lining that has good integrity and is not permeable. And if you have low levels, then you're more likely to have gut permeability issues. IPA is derived through the tryptophan pathway, so it starts at tryptophan that you take in the diet, and then you metabolize that, and ultimately you end up with IPA. That conversion happens in a bacteria called Clostridium sporogenes, and when you have high levels of Clostridium sporogenes, then you make a lot of IPA, and it reflects this beautiful circle of the gut and the body linking up together. And IPA is fundamental to me because if you don't have a good intestinal lining, then you can't move forward with health, because that's the border. We really have three barriers in our body. We have our skin, we have our gut lining, and we have our blood-brain barrier. And if any one of them gets compromised, your health cannot be good. It's just not possible. And so that's the one that we can fundamentally measure the most easily, and look at and say, okay, is this good? And if not, then you have to focus on that first. Before you can move forward with anything else, you have to focus on that and figure out how are you going to improve that.
Sounds amazing, and it works. And your patients, how do they do?
Patients do fantastic. I mean,
what do they come in with? What are they usually coming in?
So patients come in with everything. So, I think that when you think about it, people fundamentally come in with fatigue and depression, insomnia. I think that these are three overarching things that mean so much more than that. And then they get put into categories, and then you have sort of an option at that point with fatigue, insomnia, and depression. And you can say, oh, well, you're depressed. Here's an antidepressant.
As if they're missing an antidepressant.
Right, and then you can say, oh, well, you're not sleeping well. Here, take the sleeping pill.
That's going to help a lot.
Exactly. Or you could say, well, let's fundamentally dive deeper and say, as a human, you should not be depressed, you should have plenty of energy, and you should sleep well. And then say, how do we restore that? What got out of balance to do that? And I think about this a lot of times, and I think about it and say, well, what's my real goal in being a doctor? What am I trying to do? I'm trying to make somebody healthy, but at the same time, I'm trying to become a conductor of a symphony. And all the instruments in the symphony are all the metabolic processes. Right. And if I can make this level go up and this level go down and make it beautiful and make everything in resonance with each other, right, then I'm a beautiful conductor. And then I have this wonderful symphony that sounds great, and I, as a doctor, should be able to hear that and say, oh yeah, everything is good. And that should come across through a patient saying, I feel good, I'm active, I'm exercising, I don't have stress, I'm sleeping well, I'm very happy, I have good relationships. It should come across, that's how the music should be playing. But me as a conductor, I have to be able to look at it and say, okay, I need to make an adjustment here, I need to make an adjustment there to make the music sound beautiful for the patient.
And you do. And that changes medicine.
That's the goal.
So thank you so much for helping us. You are changing medicine, and we keep on doing it. Thank you so much, Dr. Wilkes.
Yeah, wonderful to meet you.
Nice to meet you.